Hello?
Hello.
May I come in?
Yes.
All right. Hi, my name is Carmel, and I'm a nursing student. First, let me explain. Today I'm here because the doctor ordered to have a head-to-toe assessment on you today. Before I do that, let me wash my hands, make sure my hands are clean. And could you please verify your full name and date of birth for me?
Abigail Abathorn, May 5th, 2005.
Okay, Abigail, and let me check your wristband and make sure. Okay, thank you. And so, I'm gonna ask you a question. So can you tell me the name of the president?
Joe Biden.
Okay, and can you tell me where you are right now?
I'm at Kennesaw, Cobb County.
Okay, and can you tell me today's date?
September 26, 2023.
Okay, thank you for that. And Abigail, before we start, I'm gonna ask you, are you in any pain today?
No,
0 to 10. 0 means no pain, 10 is the worst.
0.
Okay, and Abigail, have you emptied your bladder in the last 30 minutes?
Yes, ma'am.
Okay, all right, so first I am going to start with your hair. I'm starting with the face hair, and I'm looking at your hair. I'm gonna palpate your hair for any tenderness and any lesion, any discoloration, and I'm looking, the hair is evenly distributed, no lump, no tender. How does that feel?
Fine.
Okay, and I'm going down to your face, and the face is round and symmetry, and I am going to start. I'm gonna ask you to raise your eyebrows for me. Okay, good. And this is nerve 7, and I'm gonna ask you and Abigail to smile for me, and then this is still cranial nerve 7, and I'm gonna ask you to open your mouth for me, and I'm gonna use a tongue depressor to check for your gag reflex. And I'm looking at your mouth, teeth. The mouth is pink. The buccal mucosa is pink, no discoloration. Gum, no bleeding, no swelling, and no rashes, and no missing teeth. And the tongue is in the center, and the uvula, the rise of the uvula is normal, and tongue is pink. And I'm gonna use this in your mouth, Abigail. Okay, very good reflex. And I'm gonna move to your eyelashes. They're evenly distributed, and no discoloration, the cornea and the conjunctiva. And I'm gonna Abigail, if you can look at my ear, I'm gonna check your eye. Okay, I checked the pupil, the pupil, ecro, and round and reacted to light. And also I'm gonna check and your nose. I'm gonna check for patency of airflow. If you can press down on one side of your nose for me and breathe in nice and okay, and go ahead and do it on the other side. Okay, great. And I'm gonna palpate the external nose. No tenderness, no redness, and no discoloration in the face, no tenderness, no swelling. And I am also going to palpate for sinus pain. Any pain?
No, ma'am.
Okay. And also I'm gonna check for the carotid artery, and I'm gonna check them one at a time. Any swelling, abnormality, I will go ahead and use the bell of the stethoscope to check for any brewery. And also, while I'm here, I'm gonna check for the mastoid process to make sure there is no tenderness, swelling, any abnormality and on the mastoid process. And I'm gonna move on to your auricle and the tragus and the labial. And I'm looking at the auricle, I'm palpating the auricle, and nice and soft, no redness, no discoloration, no rash. And also I'm gonna use my pen light to go into your ear to look for any earax, cerumen, any drainage, any redness, no swelling. And I'll look in both. No swelling, drainage, earax, cerumen, and they are evenly in size. Distribution, color is pretty consistent in both ears. And I am going to look inside of your nose to look for any discharge, any mucus, anything, any redness, and it's normal. There is no abnormality. Also, I'm gonna check on your lips, any cracked on your lips, any lesion, any discoloration, any dryness, and I don't no presence of anything like that. And I will go ahead and ask you to smile for me. This is cranial nerve 7, and I'm gonna ask you to blow your cheeks for me. Okay, and no abnormality. And I'm gonna ask Abigail, can you raise your eyebrow for me? Okay, this is cranial nerve 7. And also I am going to do sensation test on you, and I'm gonna ask you gonna close your eyes for me, Abigail. And this is cranial nerve 5. I am going to ask you to tell me which side of your face I'm touching.
Left cheek, chin, forehead.
Okay, now you can open your eyes, Abigail. And now I want you to go ahead. I'm gonna check for movement and strength of the neck. So I am asking you to move the neck to the right side for me and move it to the left. And then can you move it down to your chin and move it back and look at the ceiling for me? Okay, no abnormality, and no pain during those movements. And Abigail, I'm gonna ask you to shrug your shoulder for me up. All right, so bilateral shoulder strength 4+, no abnormality. And I am going to check on the trachea, which is it's in the center right here. No lesion, no tenderness when I touch it, and no discoloration. Is the skin is constantly distribute color is consistent. And also I am going to check on your neck. No swelling, no rash, and skin is intact, warm. The skin is warm, intact, and no lesion, and no rash. And also I'm gonna check on the jugular vein no distension. Any pain when I touch over here?
No, ma'am.
Okay. And also I am going to look at your arms, your extremities, upper extremities, and skin is evenly distributed, no discoloration, and skin is intact, warm. And when I come over here, I'm gonna check for your radial pulses. Radial pulses are no threading, no bouncing, and pulse are 4+. And I'm gonna check for your ulnar pulses right here. No threading, no abnormal pulses, 4+ on the ulnar. And also I'm gonna come here, I'm gonna check on your fingers, and I'm looking at your nail bed, no discoloration, no clubbing fingers, and nice and pink. And I'm gonna turn them over here. Your palm, they're nice and moist, no dryness, and skin is warm and intact. And I'm gonna ask you to push down on my hands, and the bilateral strength upper hand, 4+, no abnormality. And I'm gonna push down, 4+, no abnormality. And I am now, Abigail, I am going to check for your popliteal pulse and the back of the knee. No threading, no bouncing, 4+ pulse. And also I'm gonna check for your, and make sure that before, when I started with you, I bring my bed to the level to prevent injury. I would do that to bring my bed up, make sure that you at the level, so I can prevent injury. And now I'm gonna check for your and your fit. I'm gonna do range of motion. Okay, any pain?
No, ma'am.
Okay, I'm gonna check the right one, range of motion. And I'm gonna check for the ankle for edema and any skin discoloration on the toes. And I will go ahead and do capillary refill on each toe, less than 3 seconds. And also the nail bed of the toes, no discoloration, no redness, and anything like that. No abnormality. And I'm gonna take your, can you push your foot back for me? Any pain? I will move it up. Any pain? When I do that, Abigail?
No, ma'am.
Okay. I'm gonna move it, flex it, and there you go. Okay. And then I'll use my hammer to do the reflex. And okay, there you go. Normal. Here, no abnormality. And then now I am going to move on to checking of and also the eye that I did earlier is the optic nerve 2, and then the nose is the olfactic cranial nerve 1, and also the gag reflex was the cranial nerve 9 and 10. And so now, Abigail, I'm gonna do what you call a whisper test, and this is cranial nerve 8. And I'm gonna go in the back, and I'm gonna give you a combination of letters and numbers, and then you're gonna close. We're gonna do it on both ears. You're gonna close one at a time. You're gonna press on the triggers, and then I'm gonna say those letters and numbers or number, and you're gonna tell me what you heard, okay? You call that a whisper test. M-A-R-2.
M-A-R-2.
Okay, Abigail, can you do it on the other side for me now? H-E-R-20.
H-E-R-20.
Thank you so much for doing that. And this is cranial nerve 8. And now, Abigail, we're gonna move on to, if you can, well, we can go ahead and do the check. Gonna check your we're gonna do the heart sound, and and right now I'm looking for in your breathing, I'm looking for any depth and rhythm and rate, and no abnormality, no wheezing sound, no right now. So I'm going to listen to heart sound. This was your aortic artery, pulmonic. This one is the herbs point where we listen for murmur. And Abigail, I'm gonna lift this. This is a tricuspid. And this is a mitral valve. And I'm going back with my bell. The herbs point, pulmonic artery, and the aortic artery. Okay, no abdominal sound, no adventitious sound, and no wheezing. And now I'm gonna do move this. Okay, Abigail, no wheezing, no abnormal sound, no adventitious sound, clear. And now I'm gonna have you face over here for me so I can listen for long sound. no pleural rub sound, no wheezing, no abnormality sound, lung sounds clear. And now, Abigail, if you can come and go this way for me. If you can come down a little bit. Now I'm gonna move on to the abdominal, and the abdominal, I will inspect your abdominal, and I'm gonna ask you, have you emptied your bladder? Have you gone to the bathroom in the last 30 minutes?
Yes, ma'am.
Okay, and so I will inspect, and I will auscultate after I inspect, so I don't alter the bowel sound. And I will go ahead, I will listen to check. First I'm gonna we'll check for any distension. We're gonna check for any lesion, any masses, any discoloration, and the umbilical centered, and the color is evenly distributed around the abdominal, and no tenderness. And I will listen to each quadrant for 1 minute, and if it's if I do not if no sounds, no bowel sounds, I will listen to each quadrant 5 minutes on each quadrant. Okay, and also when I do that, I'm gonna listen for frequency. When you do that abdominal, you listen for frequency, for frequency, intensity, and pitch sound. And I did not hear any abdominal sound. And now I'm going to do and now I will go ahead and listen for vascular sound, and where that I will use the bell to listen for any brewery sound. This is gonna be the aortic artery. This is the renal artery, iliac artery. And I'm gonna slide this down, Miss Abigail, for your femoral artery. Okay, so I did not hear any brewery, any abnormality, and so you can come up for me, Miss Abigail, and wait for the jugular vein that I palpated earlier. If I did find some inflammation or anything like that, or the carotid artery, if I did find some tenderness or any abnormality, inflammation, I'll use the side of the bell to listen for some brewery. And also, we can also do look at your wrist to look for any for movement to make sure when I do that, any pain?
No, ma'am.
No. Okay. This is range of motion of the wrist, and also okay, and let's and then so once I'm done with you, I will how did that go for you? Any pain? How did you find this head to toe? Are you okay?
I'm perfectly fine. It was good.
Okay. And at this point, the patient's response to that head to toe assessment, there were no pain, discomfort, and at the very beginning, if you had any pain, we will have to assess your pain, making sure before we do the assessment and you're not having any pain. That is not something we would want to do while you're in pain. We'll have to address your pain first. And also, we've about to be done with your assessment, and then the response that you there were no discomfort or anything like that, and your breathing were normal, and no abnormality, no wheezing sound, anything like that. Lung sounds pretty clear, and also I will make sure, and I did say if the bed low, when I come, I'll make sure that the bed is raised to the high level to prevent injury. And also I will bring your bed down for safety, and also I will give you privacy to make sure you have privacy, and also bring the bed to the lowest level, and make sure that I give you the call light if you need any help, and also make sure the call light is right next to you. And then I'll go ahead and gather all my supplies and make sure I wash my hands, and then I have to go and go ahead and when I'm leaving, Miss Abigail, would you do you need anything?
No, ma'am.
Okay. And if I will come back in 30 minutes just to check on you and make sure you are okay, and also I will get all my supplies. Wash my hands and gather all my supplies. And at this time, the head to toe assessment is done, Miss Abigail. Would you like me to close the door or leave the door open?
You can just leave the door open.
Okay. So I've already put your bed to the lowest level. You have the call light. If you have any questions or if you feel anything, please call me and let me know. Okay. And then, so I wash my hands, and I will document the findings, and that is it for our head to toe assessment, Miss Abigail. And I really thank you for letting me do the head to toe assessment today. Okay. All right. Thank you so much, ma'am.
You're welcome.
Okay.